This next session rings so true to me because I know a lot of people are dealing with, depression and other mental health issues. And I kept thinking about, the days you can't leave the home, or even the people that are so depressed that they can't even get out of their bed to get medication at the Walgreens down the street. Doesn't make sense for people that don't understand, but the people that have it are dealing with it daily. So when I started talking to the Doctor on Demand people about their in business we call it their play in mental health, but their offering in mental health and how they're going to be able to bring that to people. I feel it's a very, very important topic. So I'm really excited to introduce our next speakers. Jim Murray is going to be leading this discussion, this interview with, he's the chief correspondent from Inside Edition. Dr. Phil McGraw, most of you know him as the host and executive producer from the Dr. Phil Show, but this year he's here to talk about his role in his founding of Doctor on Demand. So I'm really excited to welcome them to the stage. Big round of applause.
I'm supposed to be over here?
No, you're supposed to be there, I think. Yes.
You have screwed up already.
Welcome to all of you. Welcome to Dr. Phil. I've been fortunate to have been a guest on Dr. Phil's show a couple of times. He's always been very gracious. He's made a real difference in my life and a difference in the lives of so many thousands of people that when he asked if I would conduct this interview, I was very honored, and I'm happy to be here.
Well, thanks for doing this.
We're here to talk about, it's basically a new approach to medical and mental health solutions for people that you can address with your pad, your phone. When you think back to when your show, the Dr. Phil Show, premiered 13 years ago, it almost seems like another era. It was another era. There was no iPhone, there was no Twitter, there was no Facebook. Now, when you want a taxi cab, go to Uber. When did you see with your app, your service, Doctor on Demand, when did you see the merging and the opportunity to bring technology and health care to the masses?
Well, the truth is, if you have worked inside the healthcare delivery system, then it's built into your DNA that the challenge is delivery. That's always been the challenge, is how do you serve those that are underserved? How do you get the service to those that have a difficult time getting to the doctor, have a difficult time getting to mental health services of any kind whatsoever? So that's baked into you as someone in the healthcare delivery system. And as we've seen the change of technology with smartphones and laptops and the pads and that sort of thing, then you start to ask yourself, how can we use that to apply? And you're right, I started the Dr. Phil Show in 2002, and think back. Then Blockbuster Video, was there a strip mall in America that didn't have a video rental center? That's gone like buggy whips. I mean, it's just completely gone. It's changed. Now everything is...
I think everything's gone like buggy whips.
Yeah, it's downloadable. Tower Records in LA on Sunset, remember?
Yeah.
It was in there, it was huge. That was the hangout center. You don't have records anymore. You don't have that. It's all now handled on these digital platforms. People are getting information differently. Why shouldn't they get medical information differently? Why shouldn't they get mental health information differently? And so we started saying, all right, how do we do this and provide quality service to people in an accessible way? And it doesn't matter whether they're in a rural area or they're in the middle of New York City. How can you get it to them? And I think everybody already knows Doctor on Demand on the medical side. You click on and you can be face-to-face with a board-certified physician in about 2 minutes, as opposed to a 20-day average wait period. And then you go into an office, and if you're not sick, you will be after sitting in the waiting room office with people that are sick. So you got 2 minutes wait time instead of 20 days. You don't have to get dressed, you don't have to drive, you don't have to park, you don't have to get a sitter, et cetera, et cetera. And now we're extending that to the mental health services as well, so you don't have to do all those things to get that kind of.
And all of this is under one umbrella, Doctor on Demand. You go to the app, and most of you have probably checked the app. It's very easy. I mean, I'm registered. You use your credit card, but you don't pay until you use the service. But this new service that you've launched, the mental health aspect, the mental health component, is actually being launched today, went live a couple of weeks ago. Talk about that, because that's a new service. And when you talk about Doctors on Demand, the service I was familiar with, if you think you burned yourself, you want to talk to a doctor, you can show them on your iPad, doctor, what do I need for this? I need an antibiotic. But from a psychology standpoint, it's a different animal.
Well, it is a different animal. And on the medical side, understand over 90% of people that see a doctor don't get hospitalized. So that means it's handled just in the interaction between the doctor. And on the medical side, we're able to treat 17 of the top 20 reasons people see doctors. You know, gastrointestinal, you know, the urinary tract infections, the flu, things of that nature. Able to prescribe medication, all the things that you would do if you saw a doctor. And with the mental health services, these are all doctoral level therapists. They've all been vetted, they're all licensed. So, you know, you're sitting at home, you got to go through a phone book. Well, is this person the kind of person I want to see, or are they not? Whatever, that's all been done for you. And you're able to make an appointment with this person. You don't just take whoever at random, like you do on the medical side, as you would in an urgent care or an emergency room. You're able to go through and select the type professional you want, make an appointment, and then you just see them on the digital platform face to face with your iPhone or your laptop or your pad.
But with the mental health side, as you mentioned, if you use Doctors on Demand because you have a cough, or you think you have the flu, or you have chest pains, you get the doctor on call right then. With a psychologist, it's a different kind of relationship.
Right, it's an ongoing relationship. And you know, here's the thing. If you're wanting to form a therapeutic relationship with someone, it's most likely, and you know, it's the same thing I've said about the Dr. Phil show. I'm not under the misapprehension that we're doing 8-minute cures up there on the stage. I'm not fixing people on the show. I'm pointing them in the right direction. I'm trying to give them a wake-up call and be a kind of a compass that points them in the right direction. The real work starts when they get home. And I'm very proud to say I think we're the only television show in the history of television that follows up with the guest after the show. In fact, to date, we've just crossed the $22 million line in providing aftercare services to our guests once they leave the show. In terms of these type services. So it's mental health, it's an ongoing thing, maybe short term, maybe long term. So you form a relationship with somebody that's ongoing. So here on this side of the Doctor on Demand app, you're able to select this person and then set up regular appointments with them. But here's the thing, you can close your office door and do it. You can do it from home. If you're traveling, you're on the road, you don't have to miss an appointment. You can do it from your hotel room. You can pull over to a rest stop, whatever. You can do it from wherever you are. So you're going to do it with a greater degree of regularity. And there's a lot of pluses to doing it.
I think, and more importantly, you may see that doctor the first time when you might otherwise say, you know what, I don't want to drive across town, or I don't want someone to see me in that waiting room, or to see me on the street where they know the doctor is. You know, there are a lot of obstacles to getting to that doctor the first time.
You know, I spent 12 years in private practice, and by the way, I was probably the worst marital therapist in the history of marital therapy.
Why do you say that?
Well, I just didn't have the temperament for it. I would talk to a couple in the first 5 minutes, I'd say, hell, I can't stand either one of you. No wonder you can't get along. Hell, I agree with you. I get out of it. It just didn't work out, so I did other things. I will say I've been married 38 years because I know when to shut up. So I think I'll change the subject and shut up. My dad actually taught me that. He said, boy, don't ever miss a good chance to shut up. But, Here's the thing. When I was in private practice, a lot of people chickened out. You make that first appointment. It's hard to make that first one. You got to make the appointment, and then you got to keep it. You got to go over there, and you're kind of scared. Is everybody going to stare at you when you walk in? There's still a stigma to mental illness.
Sure.
You're going to walk in, people are going to see me, are they going to judge me, are they going to worry about it? You don't have any of that here. It's all done privately. There's a certain degree of anonymity here. And I think it allows people to get past that initial hurdle without fearing judgment, without walking into that chasm of the unknown.
There's also the cost aspect, and discuss with the folks the cost structure, because it's unlike much of what's out there in the medical field. This is affordable.
Well, it is affordable, and that's the whole point to this. If we're going to do something that's scalable, then it's got to be something that is engineered for the average American. And the truth is, therapy is very expensive. And having spent time as a private practitioner, you've got office costs, and you've got people that have to help you with scheduling and booking and all of that sort of thing. So the average is somewhere between 30 and 40% overhead. And when you can eliminate that, thank you, when you can eliminate that by doing this on the digital platform, then we're able to pass those savings on to the patient population.
So Doctor on Demand is what, $40 for 15 minutes?
Yeah, on the medical side, it's $40 for 15 minutes with a doctor, which is longer than you usually see the doctor in the office.
Right.
It's less or equal to an average copay for most people if they have insurance. It does apply to the flex insurance payment where people have to reach like the $2,000 limit before their insurance kicks in. It does apply, so in that sense it does apply to the insurance. On the mental health side, the costs are, depending on what city you might be seeing a therapist in person, it's somewhere between half and a third of what you would be paying that person if you were seeing them in person. So it is very affordable.
You mentioned a minute ago that your show follows up with people after they're a guest. You check up with them. You do the same thing with doctors on a Doctor on Demand. You check up with them. There's an internal rating system for you to make sure that your clients, your patients, are getting the services that they need.
Yeah, all of our patients rate all of our doctors after a visit. And if they're not getting the ratings, then we immediately get in touch with that patient. We find out what we can do to make that service better. And if those doctors aren't doing what they need to do, then they're out of the rotation. And we have about 20% of the doctors that are trying to get on Doctor on Demand actually get on staff for Doctor on Demand. We have way more doctors than we actually use. So we take the cream of the crop, the best of the best, both on the mental health side and on the medical side.
On the mental health side, do you envision someone using this service on a weekly basis and establishing a relationship with a doctor?
Yes, that's up to the doctor and the patient, whether it's weekly or a couple times a week or monthly, whatever is necessary.
And how does it, most people in this room have used FaceTime. How does that apply in a psychology setting?
Well, here's the thing, and I've been asked in some interviews before, is it as effective to do this type of therapy as you would if you were in the room with the person? And there are pros and cons to it. I mean, obviously, if you're in the room with the person, there's a lot of visual cues that you pick up on. There are things dynamics that come into play if you're there in the room. But if you're on the digital platform where you're looking at this person on a screen, you still have a lot of visual cues. And with these high-def cameras now, and if you've got reasonable lighting, I mean, you can still pick up if they're flushing in their neck or their ears are getting red or if they're looking away from you or whatever. Signs that are important to a therapist are still available to you. But I tell you what we found is that sometimes these people are more candid with their therapist if they're not actually in the room with them. And the interesting thing is, if you look at the psychodynamic model of therapy, which was the beginning of the talking therapy model, if you take it back to the Freudian era, these therapists often sat behind the patient out of their visual range. They didn't have visual cues from the patient. They sat behind them out of their visual range. They couldn't see them, and the patient couldn't see the therapist. So there's much more available here, even with the original model. So it's kind of like everything old is new again, but I think certainly it's a wash. There are pros and there are cons, but I certainly don't think you're leaving anything on the table.
Everybody in this room has done, I'm sure, electronic banking. We've sent emails, sensitive documents. But when it comes to healthcare, we all worry about privacy. If you need, I understand that if you have certain photos that you want sent to the doctors, there's a Snapchat-like feature built into your program to erase those, and what else do you do to protect a patient's privacy?
Well, our side is 100% HIPAA compliant, so everything is protected, and it's funny to use protected and website in the same sentence right now,
Sure.
On the heels of Sony and the interview and all of that type thing. So I suppose everything is constantly in play, but we're heavily encrypted, and we do everything that we possibly can, and we are HIPAA compliant. So we're very, very sensitive to protecting patient privacy, and probably more so than if your records are kept digitally in a doctor that you were seeing individually.
Most folks at CES are looking for the next disruptive product, technology. In your view, Doctor on Demand is that product in the medical field?
Well, I think it is, and I think it is time that we disrupt that. Look, the whole idea, and I think the reason the Dr. Phil Show is #1, and the reason that we've been on the air for 13 years, is because we're delivering common sense, usable information to people's homes every day for free. And that has been a disruptive force. I mean, we are giving people evidence-based therapies about teaching tool guests every day to their living rooms for free. And I think that shows a real hunger for this. And I think that's what we're doing with Doctor on Demand. We're customizing it to individuals, so it can't be free because you have to do it on a one-on-one basis, but we're delivering it in a really affordable way. And it doesn't matter if you're in Spokane or Omaha or some little town in West Texas, you can get quality care right there. And I think that's the big play here. I mean, there was an article in Motley Fool yesterday about why is this billionaire investing so heavily in this telemedicine company. It was about Richard Branson investing in Doctor on Demand. And the reason is because this is a game changer, and it's being received that way. It is a game changer.
And talk about you know, when you call an Uber, you don't necessarily know much about the driver. You do know about your doctors. You have bios of the doctors. Talk about the interaction and the importance of knowing who's treating you and the trust, the relationship that you build up with that doctor.
Well, you know, it's that old joke about, you know, what do you call the person that graduates last in their class at medical school? Doctor. You don't really know the difference between the person that graduated first and the person that graduated last. Well, we do know the difference because we vetted those people. We put their bios up. We know that they're licensed. We've looked for complaints and actions against their license. All that stuff is available for you to look at when you select that medical doctor or that therapist. So we've done that homework for you on the site. And frankly, they're not going to be on our site if this person is on the fringe. They're going to be solid professionals, and that's not our view, that's the state license board's view. We've done that homework for you. We've vetted it for you, and we've put them up there, and you can go through and pick the one that you want, and that's who you go to. And if you don't like them, then you do another one until you find the place that you're happy and the place that you feel right.
I talked to your son Jay, who co-founded Doctor on Demand, and as a parent, I would have assumed that the first group of people that would use Doctor on Demand would be parents with kids who are sick.
Not true.
Not true.
Not true. Parents don't want to use their children as guinea pigs. What they do is use it first themselves, and once they see it works, you know, the biggest challenge we've had in launching Doctor on Demand is people think it's too good to be true. They say, you're telling me I'm going to be face-to-face with a board-certified physician in 2 minutes, and they can fill a prescription, or I need a referral before I can see a specialist under my insurance, and this counts for that, and I can get that in 2 minutes, come on, 40 bucks, come on. And they do it and they go, wow, that really does work. And then the word of mouth has just gone crazy. And that's been the big game changer for
And you talk about the fact that once a parent feels comfortable, because you have an entire pediatric component that, really a component dedicated simply to treating children.
Yes, we do. And once the parent uses it, and then they go, okay, this is safe for my children, I don't feel like they're being guinea pigs, then they become our most prolific users. I have 2 grandchildren, 4 and 3, and they're little petri dishes. I catch everything. It's just astounding what they are taking me back through now. And so they do get things that can be treated in routine medical care a lot. So we do have an entire section dedicated to pediatric care.
And when you talk about filling prescriptions, walk us through, if you could, a typical call and what type of prescriptions can be administered.
Well, we're able to prescribe everything except those medications that can be abused. And we're not going to give you narcotics over the internet. We're simply not going to do it. I don't care who you are, I don't care what you say.
But if I need antibiotics?
Antibiotics, we're going to give it to you. That's not a problem. We're going to give you those things that you need, whether it's antibiotics or anti-inflammatories, or if you need Flomax, or you can get Viagra if you need it, whatever. So I'm told. That's what I'm told. Whatever you need. The only thing are those medications that can be abused. We just don't feel like we should do over the internet, so we just don't do it.
And what are in your view, what is the biggest obstacle to getting people? It's that first time. The first time you use it, that's the critical time.
It is the first time, because people are like, well, I mean, can they really ask me the questions they need to know what they need to know to diagnose this? And the answer is, in most cases, yes. And this is not for emergency care. I mean, if we see something that we believe involves emergent care, we'll call 911 for you while you're there. If you should have called 911, we'll do it while you're on the line. We'll get you help instantly. But if it is for, as I say, 17 of the top 20 things, then we can help you with it, and we can call in the prescription. I mean, it goes in right there, and it'll be there by the time you get there.
And I mentioned photos, because generally you think of this as a FaceTime experience, but if you're holding a phone, and you can use this on your tablet, on your computer, on your phone, the doctor looking at you may say, take a photo, higher resolution, send it to me on the phone call. They'll examine that, and is that experience as viable as, say, going into an emergency room?
I think it certainly is. And, you know, from a mental health standpoint, I think this is particularly, I'm glad you're asking that, because from a mental health standpoint, maybe there are things that have gone on. A parent has found something in the child's drawer. Is this drugs? Is this not? They can take a picture and send that. Maybe there have been letters back and forth between a couple. They can upload those to the therapist that can read them and refer to them as they go through the session. Everything you can do in the room during a therapy session, you can do during a virtual therapy session.
And you talk about the stigma, specifically with mental health care. Are you hopeful that this technology will enable you to maintain some control through some anonymity? Even though I have a relationship with you as a doctor and I can see you, I can talk to you, I'm not getting in my car, I'm not driving to you, and nobody sees me in your office.
Well, I don't think there should be a stigma. And I'm sorry that there is, but for those people who do fear judgment or they do have anxiety about it, I think this is a fix for that. I do think that helps them overcome that obstacle. I'm sorry that that exists, but if it does, then I think this allows them to do that. But one of the things about mental health that I think is important is that you build across time. You learn something in session 1 that you build on in session 2. And I can tell you as a practitioner, the thing that was the most difficult thing for me to overcome was people that missed appointments. We'd make some progress for 1 week, 2 weeks, 3 weeks, then we'd miss for a week or two. And maybe it wasn't denial or avoidance. Maybe they really were sick or they really were traveling. I think so many of those appointments in retrospect would not have been missed if they could have punched it up and been right there, even if they were sick in bed or sitting in their recliner or calling from a hotel room from the East Coast. We could have maintained the progress that would have helped shorten the overall process for the patient by improving the integrity and quality of the work that was being done at the time. So I think the biggest thing was regularity and continuity, and I think this really is a cure for that. I think this is going to be a big boon to overcoming that big problem.
And this group is probably more tech savvy than most of the country, but they're also consumers. They also go to doctors. So if you're talking to them and they have two questions, and you had to address, what's the biggest fear in using Doctor on Demand, and what is the biggest benefit?
Well, yeah, I think the biggest fear is this really going to work? I mean, it sounds great, but I think tech savvy people understand that you truly can. I mean, look, we shop online now, we bank online now, we do taxes online now. I mean, when I went to graduate school, I lived in the library.
Yeah, I did too.
Now, you don't go to the library. I mean, everything, you're able to do it online. We're shifting the way in which we gather information, exchange information. Why would it not naturally extend to exchanging information about our health, whether it be mental health or medical health? So it seems to me to be a natural extension of the way we're interacting with information in our world today. And you know, I'm not a tech savvy person. I'm not, but I am a user, and I am savvy in healthcare provision. So to me, those two things brought it together. And I think the biggest benefit is it is very user-friendly. I mean, if you go to either a therapist or a medical doctor, you spend more time getting there and back than you do actually getting the care. And we've eliminated that 100%.
And it takes just moments to really.
Yeah.
Do you see this, as I mentioned earlier, if you talked about just touching a couple of keys on your iPad and getting a cab, it was unheard of just a couple of years ago. Do you look at this as the future of at least a portion of medical treatment?
Well, I don't think there's any question about it. I mean, if we look at what's happening in medicine right now, we're able to, with robotics at this point, to do surgery in third world countries with robotics from here. We're able to do things remotely, and it has been life-saving. And I think it is the future. And if we can do that, if we can oversee and actually perform surgeries on another continent, I think we can cure a cold. I think we can treat a urinary tract infection.
And you can use this. This is basically your doctor in your pocket, if you think about it. You can use this anywhere you go. All 50 states, people are licensed, right?
Right.
So if you're traveling, you're on vacation, you're at work, you have a doctor available to you pretty much anytime you need one. Is that correct?
Yep, medical or psychological, either one.
And I just think we need to get an autographed photo of Dr. Phil the first time we use it, and then you're going to sell a million,
Yeah,
right?
yeah, because you sure want a picture of this head, don't you?
Well, is there anything else you want to leave these folks with?
No, I think you've done a very good job of teasing out the information, and I hope people really open their mind to saying we're able to avail ourselves of these services and talk to people about it, particularly those that are in the really hustle bustle of the world, or those that are in remote areas where, you know, frankly, sometimes the best professionals don't go to the areas where there's not high volume. I mean, we don't like to say it, but healthcare sometimes becomes a volume business. You have to do a high volume to make it work. And so you get into the rural areas, you don't always get the biggest smorgasbord of choices with specialists and therapists and that sort of thing. But now it doesn't matter whether you're in New York City or Timbuktu, you have access to the best of the best.
Hey, I saw your name mentioned in a Time magazine article about CES, and it's funny to see the name Dr. Phil at Consumer Electronics Show. Jimmy Fallon mentioned you earlier this week, and Doctor on Demand. Last question, what is the importance to you of this technology of Doctor on Demand going mainstream to a point where it's not only heard of, but it's accepted and it's embraced?
Well, I'm actually glad to hear that. I mean, I'll get Jimmy for that. I see him in a couple of weeks, and I'll be getting even with him for that, probably shave his head or something. But listen, I'm glad to hear people talking about it. Doctor on Demand has jumped above the noise, and it has really taken a commanding position in telemedicine, and so it's become part of the pop culture and part of the ether, and people are talking about it, and that's a good thing.
Dr. Phil, thank you.
You.
Dr. Phil
Appreciate
McGraw.
it. All right, thanks, Jeff.